Thyroid treatment success secret number 11, blood sugar glucose. From a medical standpoint, normal blood glucose levels have a broad range of 70 to 105, while functional or optimal blood glucose levels are 85 to 99. According to the American Diabetic Association, a blood sugar level reading of 106 to 126 is termed insulin resistance, or pre-diabetes, and anything above a reading of 127 is diabetes. Granted, those are fasting blood glucose levels, and it is important to note that because many times I will see patients who have been tested and I ask them if they've been fasting, and they will tell me no, you need to at least a 12-hour fast, which means absolutely no food, no drinking of orange juice or coffee or anything, just water for 12 hours before you get an accurate test of your blood glucose levels. Supporting hypothyroidism is futile if your blood sugar level is too high or too low. A reading below 85 would be termed hypoglycemia, and a reading above 99 would be termed hyperglycemia. This is called dysglycemia, and this is a stepping stone to diabetes. Diabetes is becoming so prevalent in the United States that authorities are predicting that it may bankrupt the healthcare system. Hypoglycemia is a condition in which the blood sugar level repeatedly drops too low in response to high carbohydrate foods. Refined sugar is a good example of high carbohydrate food. It can also be a result of going too long without eating because many Americans are skipping breakfast. It's important if your blood sugar is below 85 that you eat every 2 to 3 hours. You should have a breakfast, a snack, lunch, a snack, dinner, and a light snack before bed. The snack can be vegetables, fruits, nuts, and their seeds, but it should be something healthy. Insulin resistance is high blood sugar, but it hasn't reached the point of diabetes. It's called pre-diabetes, and it's a result of the cells becoming resistant to insulin so that no glucose enters the cell to make energy. You need glucose in your cells to make energy. It's a vital, important part of life. Your brain and nervous system need two things to survive: fuel and activation. Fuel is oxygen and glucose. You see, glucose travels in the bloodstream until it's turned into triglycerides for fat storage. That's why it's important to monitor triglycerides as well as glucose. The process of going into fat storage demands an increased amount of energy, causing the person to feel tired after eating. So when a person is eating a high carbohydrate diet filled with white bread, pasta, and refined sugar, they cannot keep their blood sugar levels stable. If a patient feels sleepy or they crave sugar after eating, you know they just ate that way too many carbohydrates. If you feel sleepy after a low or no carbohydrate meal, you are most likely insulin resistant. It's literally impossible to support hypoglycemia or insulin resistance unless you eat a healthy breakfast with ample high-quality protein. You need to eat protein in the morning, not carbohydrates. You need to eat eggs. You need to eat meat such as turkey or chicken sausage. You need to eat protein in order to support your blood sugar levels. Even if you feel nauseous the first thing in the morning upon waking, eating breakfast is critical, and eating a breakfast of high protein will most likely relieve your nausea. Finally, if you have hypoglycemia, you should never fast. It will make matters much worse. Don't suffer another minute. Call our office at 336-229-4226 and schedule 2 free visits with Dr. Naylor. Call now. Space is